Dr. Avery Hines himself, the technical director of the epidemiology division in our Ministry of Health. Hines responds to unsafe safe zone claim. Epidemiologist Dr. Avery Hines declared on Wednesday that there is no scientific justification or any other justification for the government to shut down safe zones. Hines was responding to a question about the call by the National Trade Union Center. This is what he said. There's no logical or scientific basis on which to claim that the measures to reduce risk during public interaction would be conversely increasing the risk of transmission. What you would see is if the measures aren't adhered to, if people trying to find loopholes to escape the various requirements, that these would increase the risk. But we're going to hope that those aren't in the majority and to re-emphasize that all of the requirements for the operation of a safe zone are basically added layers of protection to reduce the risk of an infected individual being in a gathering space in the public, while trying to allow for some measure of economic activity and social activity in the midst of the pandemic. Now, the first statement I'd get into there is where he said, basically, there isn't an increased risk by the policies. If there's an increased risk, the increased risk is based upon human behavior not taking the policies seriously in those safe zones. Now, here's this. I said this in, I can't remember which contemplation, some one of the previous contemplations. If you have a policy and the general human nature shows you that people aren't obeying that policy, do we attempt to change human nature or do we change the policy? So, you cannot say that if the policy works perfectly, it would work. You have to look at how the policy works in the current realistic situations. That's how governments make decisions. You don't make decisions based upon a utopian thinking. You don't think, what would happen if this functions perfectly? That's not what you do. You have to run it in a real life scenario. You have to run it with the off chance of people doing something adverse. So, for example, in a perfect scenario, the policy should be that no bar, no restaurant, no liming place, no club should suggest to anyone that they shouldn't wear expensive jewelry. Why is that a suggestion when you go into certain places? You should be able to wear your expensive jewelry anywhere. There shouldn't be a policy that advises you against wearing that jewelry. But reality will let us know that if you wear that jewelry into certain places, reality is not everyone would obey the law and some people would go snatching that right off of your neck and maybe killing you for it too. So the policy then, if you're creating a policy, this is an example, if you're creating a policy around that, the policy has to be based upon human nature. Your policy cannot be based upon your perfect scenario of how it should work. So the statement that these are measures to reduce the spread and the problem is in people and people going against the measures, that cannot be an excuse. The reasoning has to fit in with the reality of the situation. That's the way it has to function. And if it doesn't function in reality, then it doesn't function because we live in reality. And this is part of the problem sometimes when you have academics do. This isn't a criticism directed at Dr. Avery Hines necessarily. This is on a tangential point. This is the problem sometimes when you have academics doing some of these things. If you went to university, you would know that many things that you'd study in school are done in a sample thought. You're thinking this out in a perfect scenario and it's a model of what should happen. This is a model, and if you do it like this, this is what might happen. Listen, I did sciences. Sciences are supposed to be way more precise. And even up till university, what they tell you is supposed to happen in some of those experiments do not happen. And here's a secret, especially back in secondary school, some of those results that we wrote in the lab book, we had to imagine them because it doesn't always work like that in the real life scenario. That's just the facts of the situation. When you try to bring this across to real life, it doesn't work. That's why we don't just leave our political rules, our political class. Utopian models apply to dystopian societies. Exactly. Well put. We don't just leave our ruling class to be just all the smartest people in society. We go get all the PhDs and all the professors and we tell them make the rules and make sure everyone lives up to it. No, we get some people that we hope are pragmatic leaders, that we hope can understand the plight of everyday citizens and know that the perfect sometimes is in opposition to the good. You're trying to get the perfect, and in trying to get the perfect, things are running haywire. While you could get the good and run things on good. So that could be a partial argument. And in the defense he used there, I do not see it as necessarily standing up to the criticisms of the safe zone, at least that part of his defense. He noted that any restriction or requirements that are put in place to reduce the risk of COVID positive individuals interacting cannot lead to an increase. So the science behind that doesn't really make a lot of sense. This is what he said. He noted any restrictions or requirements. That is a political statement. I am sorry, Dr. Hines, but that isn't a scientific statement. What do you mean, any restrictions or requirements? How does that work? Anything that the government puts into place and says, this is here to reduce the risk of COVID positive individuals interacting, then that means automatically it's impossible that it leads to an increase. That does not make sense. That is not scientific. That isn't backed up by any kind of evidence. And many of the restrictions and requirements that were put in place before were noted to not be as successful as they've been said. For example, a restriction that was put in place, locking people down indoors while the virus spreads indoors. Some people suggested that lockdown indoors and forbidding people from going to gyms and going to play in parks, locking the parks, locking down the open areas, and locking people indoors where 85% of the spread is inside homes indoors, that could have very well increased the spread. And that was a measure, that was a restriction put in place to decrease the spread. So the statement that anything put in place to decrease the spread cannot possibly increase it is false. And then here's this other part. Part of the restrictions that were put in place was part of the lockdowns. And those lockdowns that closed down the parks and the gyms, etc. I'm pulling up an article here. If you're over on YouTube, you'd see the article. It's from WebMD. It's a study that came out a little while ago, but it's interesting. Child obesity rose sharply during pandemic. Childhood obesity was a worrisome issue before the pandemic, and now it's alarmingly worse, new data shows. A US CDC study found a profound increase in weight gain for kids that is substantial and alarming. Dr. Alison Goodman, one of the study's authors, told the Associated Press. Childhood obesity blew up over the pandemic. Now, many people say the pandemic caused childhood obesity to increase. And that could be said as a step-by-step process. But the pandemic is a few steps away. The direct cause of the obesity, yes, it was big people obesity too. There was actually a study that I saw. I'm not bringing it up because, well, I didn't bring it up because I couldn't find it back quickly enough to get the sure information, but the information was showing a breakdown according to generations, and millennials had a scary level of increase in obesity. It was scary for millennials. So everyone had a scary level of increase in obesity, right? And people were saying that it's the pandemic that caused the increase in obesity, and that's after a while a trickle-down effect. But the direct cause wasn't the pandemic. The direct virus caused death, and people who got it might have actually lost some weight. What caused the obesity, the weight gain, was the lockdown and the closure of outside activities. Now, those would have been done because of the pandemic. I'm not arguing that. I'm not negating that. But that measure that was done by the authorities to decrease the risk of the pandemic actually worked to increase the risk of one of the chief comorbidities of COVID-19. So if COVID-19 still exists in the next couple of years, we now have increased obesity across the entirety of our society. So yeah, they're vaccinated. We're fighting to get more people vaccinated. But also, the same measures are increasing the level of obesity in the society. So to say that the measures cannot have any kind of negative relation here is wrong. And these kinds of statements, yeah, I'm sweating a bit here. And these kinds of statements, I think, are some of the statements that decrease some of the trust in these officials. When you make a carte blanche statement like that, let me read it again. He noted, any restrictions or requirements that are put in place to reduce the risk of COVID positive individuals interacting cannot lead to an increase. What is that? I don't agree with that statement. I'm sorry, Dr. Hines. It's not a nuanced enough statement for a scientist. That's a statement for a politician. Leave that statement for good old Terry to say. Leave that statement for Dr. Rowley to say. They are politicians. You are a scientist. You can speak on the science and the exact evidence nature of science. That's what you speak on. What about an increase in depression? I'm sure there's a correlation with immune responses. Yes, there is an increase in depression. There is also a ballooning in suicide rates. And all of these things are knock-on effects from restrictions done for the virus. And this isn't necessarily me saying that all of those restrictions, all of those measures were bad ideas and we should not have done them. But to make it seem like none of these ideas have any possibility of any kind of negative effect, I don't agree with that at all. He went on, I would think as a country we're happy that people are being employed in safe zones. I think as a country we're happy that we are finding a way to live with the virus to coexist. The Minister of Health was asked about the individuals who came out in the NATOC press conference. There were some people who came out in the NATOC press conference and they came out as witnesses saying that they have personally experienced negative side effects after taking this shot. To be very honest too, I've had some people tell me this. I've had some healthcare officials tell me that there are lots of cases of adverse effects that are not reported. This is what I have heard. This is hearsay. This cannot be put in court. I've heard that from people. The minister was asked about it. He was asked if it's legitimate or if it's a subtle way of promoting a no vaccine agenda. This is what the minister said. First of all, if it is genuine, we express our concerns, but we have no way of knowing because no medical evidence was put forward. There was no doctor certificate, there was no medical evidence put forward, and that is complicating the conversation, unfortunately. He's right. There was no direct evidence given. There was no doctor's certificate shown. So there was no sure way to know that these people were negatively affected by the vaccine. That wasn't known. That wasn't proven. I'm not sure if they could have proven it in that scenario. Anyway, he said he's hoping that the unconfirmed reports of causation were similar to the causation attempted to be made with 2 earlier deaths. What we would appreciate is the medical evidence that demonstrate or that make a causal link. He noted that just because 2 things happen close to each other, which is correlation, does not necessarily mean causation. Now, you know I am smiling at him making this statement. Do you know I am smiling? Here on Instagram, good night, Sea Sky Nature over there on Instagram too. I'm smiling because this is the precise argument people make against the way that our country has admitted we are checking our COVID deaths. The way we are calculating our COVID deaths in Trinidad includes the correlated COVID deaths too. Someone could die of something else, and if they are also tested positive for COVID-19, they are listed as a COVID death. So now, why can't someone who is critical of the shot say the same thing about the shot? Anyone who dies after having gotten the shot within close time, we can list them as a vaccine death. Can we? No, we can't, because correlation does not mean causation. We do have at the Ministry of Health and have had for decades a reporting system to report adverse events brought about by vaccination and immunization. It is not new. What is new is the public interest in it for which I am happy about. There are 3 pathways to which we trace these events. Part 1 is something called eSavvy, events supposedly attributable to vaccines or immunization. We also have another pathway. This is coincidental events and adverse events of special interest, AESI. Now, I found this suspicious that he brought this up. I was very interested to see, okay, we have basically a system for reporting these adverse events. I went to find it. I don't think there's public access to these events. And here's the thing, Minister of Health, if you go back to the request made from the union, let me read that over again. The union asked that there be a stringent protocol of reporting adverse events and injuries by a functional being key here, it needs to be functioning, by a functional vaccine adverse reporting system. Here's the other stipulation, which the public can access online. We cannot access it, at least I don't know where to access it. The minister didn't even tell us when he told us, yes, we do have a reporting system. Haha, we caught you here. It's only that you're now interested in it. He told us that, but he didn't tell us where to find it. We are interested in it now. How do we find those results? How do we give those results? Who gives up the suggestions of these adverse effects? And to be very honest, I am not in the typical sense of anti-vax, but I could understand some people's query and suggestion that they don't think all adverse events have been reported and tabulated and calculated. Just asking if correlation isn't causation, why all these things are suddenly happening to persons. All right. Part of this, there's a part of it that works with you just paying attention to. If you ever, I don't know how many of you ever noticed this, if someone you know, someone close to you, or you yourself, you're looking at buying a car, and you want to buy, let's say you want to buy an Aqua. You're looking for one of those tiny cars. You want to buy an Aqua. And you were looking for a royal blue Aqua. You want a specific color, royal blue. You would notice all of a sudden, you start to notice all of the royal blue Aquas all over the highway, all over the roads. So sometimes it could just be a matter of you paying attention more and noticing more. So that's why anecdotal evidence doesn't necessarily work. Anecdotal evidence just tells you one thing that happened. And that could just be a random occurrence. And even if you have a compilation of anecdotes, somebody said, I've heard this quote somewhere, a compilation of anecdotes does not make statistics. So even if you have many anecdotes, you still don't necessarily have statistical proof. So that's why you need somewhere where you can report all of these things. And even if the reports, you're welcome. And even if the reports can be suggested that some of these reports are misleading, well, at least we would be able to verify these reports and be able to look deeper into some of them. So I think we need to have someone looking into creating this VAERS system, this vaccine adverse event reporting system, and allowing people to access it online. The message I've kept saying on most of these vaccine-related topics and this pandemic-related topic, keep giving the people information. Give the people information. As much information as you can. I think the more information you give, the less it seems like you have something to hide, the more people can trust you. And especially noting the fact that this pandemic doesn't seem like it's planning to go anywhere anytime soon, you need trust of the people to make further decisions. There are more decisions that may be necessary to be made further down the line. And if you lost all the trust now, what are you going to do further down the line? Give the people the information.